Hi, I'm Colleen with VetmEDUcate, and today we are going to have Pierre help us teach you how to administer subcutaneous fluids. When you have your bag of fluids, there are two separate bags that you will receive from your veterinarian. The one that is most often used is the one here with all of these numbers, 1 through 9. But for today's training, we're going to use a smaller 250 bag so that I can go through and teach you about the numbers. When you are doing your treatments, you will have to place a needle on the end of the IV line. This needle can be used and then left until the next treatment. We just hang it so that it stays for the next treatment. And then when you're ready to use your fluid bag again, you want to remove the old needle and apply a new needle. You want to make sure that the bottom of the needle, here's the old one, the bottom of the needle and the top of the line are not touched by your hands or by the table or anything like that. We want to try to keep that completely untouched and what is called sterile. There is a small circle on the bottom of the IV line that you can spin and it tightens it on. When you're going to do your fluids under the skin, you can use several different areas on the pet, depending on how much skin they have. Some of our little furry friends have lots and lots of skin, and others don't have as much. Most commonly, the area that is used is here between the shoulder blades on the back. Understanding that when you give these fluids, you will be creating a large bubble of the fluid that is underneath. You want to grab the hair and make a small tent and open up that subcutaneous area underneath. Uncap your needle. Again, not touching anything but the injection site. You're going to administer under the skin. Again, making sure that you are under the skin and not through and through. There is a clamp on the fluid line that you'll want to roll and unclamp, which in return allows the fluid to drip, and that lets you know that your bag of fluids is running. Now, to keep Pierre nice and dry, I'm going to explain to you when the doctor tells you how much fluid you need to administer at home. You're going to look at your numbers and figure out how much you would need to give. So if we needed to give Pierre 50 mLs, we're going to go from the 150 to the 200. And once the fluid, that again is dripping in your bulb, gets down to the 200, you can just reclamp your IV line. When you're removing your needle, I like to grab a little bit of the skin and give it a little jiggle. It's okay if you see some fluid come back out because you have made a hole, but with a little bit of pinching or even a napkin or a tissue, that leak will stop. Thanks, Pierre. Appreciate it.